Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over something known as the Haddon Matrix. Now, this is something that's used in occupational health mainly, and certain environmental disasters. But this is a theory that it's called a matrix, and this is a theory that I came across about 10 years ago when I was studying at Hopkins, and we learned about this and tested on this. So I think it's important for all public health practitioners to know more about this. So the standard Haddon matrix is all over is the same. There's a five column. Uh, there's five columns in this, and then four rows. So that makes up the matrix. Now, some of this I actually drew up from Microsoft Copilot because it's something that is a useful tool as to try to utilize when it's during the discussion of this. Um, Injury prevention is actually another area. So this is a multifaceted area that is that the HAD matrix uses. So let's go ahead and get started here. So there's the main component of this is the pre-event, event, and post-event. And so those are the rows. They're not counting the row for the title, so that's why it's three rows. So in the pre-event, that's before the injury is occurring. Like that focuses on prevention. That's all. That's what public health is all about. Um, During the event, that's the injury. What is going on? Focuses on reducing severity. Um, there's not a huge occupational health department or injury prevention department in Johns Hopkins, but there is a considerable amount. So phases are pre-event, event, post-event. Now, what are the factors? And those are the columns. And of course, this is very well known, the epidemiological triad, if you've studied epidemiology. Um, and so host is the person at risk, right? And then the agent vector is the energy or mechanism causing injury, whether it's mechanical, thermal, electrical. And then environment, which is the physical and social surroundings, sometimes split into two columns. Um, so sometimes the environment is, let's go over an example here. So you have, this is the structure of the matrix, and you have the pre-event, the event, and the post-event. So um, what's the host here for pre-event? The host is knowledge, behaviors, and impairment. So that's the pre-event. Um, and then the environment or agent is the condition of equipment or energy source. And then environment is road design, lighting policies. And you can use this for individual level or a group level. So there's pre-event, and what's the event? So what are the three groups? For host, the event is tolerance to injury, protective behaviors, and then agent is crash worthiness, energy transfer, and then environment is presence of hazards and environment. So I'm actually looking at the matrix in another example. Here I've provided another example right here on the screen, but I'm going over another example. So the same. So now that we've gone over pre-event, event, now the post-event is health status, ability to seek help. Agent is fire risk, secondary hazards, and then environment is emergency response, access to care. So these are the three rows and then the four columns that are, or three, technically three rows, three columns that are used here. Um, so again, this can be used in any place, many places. Um, if even seatbelt use, airbags, fixed roadside objects when you're talking about the car crash. Um, so the purpose of the matrix is not just categorization, but it's also forcing you to consider energy transfer as the core mechanism of injury. This shifts thinking from um, accident happens to injuries follow predictable patterns, enabling more effective prevention. So this is there's a lot of different Haddon matrices that are done, such as school safety issue, travel related risk, a lot of different things. So study this a bit more if you're in public health, since this is not something that is often looked at. So I hope this has made some sense. Thank you for listening.